Massage Nerds. Today I'm going to be bringing you the muscles of the thigh. Remember that this is considered the thigh from the hip to the knee, and then this is considered the leg. So we're going to be talking about the 5 adductors, 4 quads, and 3 hamstrings. Those are the muscles that go around all of the thigh. So let's start with the 5 adductors. And what do the adductors do? They add your legs. Let's see, show it. Yeah, they adduct your legs together. Add, ADD. Extend would be the opposite. But adduct is closing your legs together, and that's what these 5 muscles do. So let's start now with the 5 adductors. You've got the most superior one, the pectineus, and they all originate at the pubis symphysis, which is the pubic bone on the anterior side. For people that have pull groin muscles, you've got to work all of these. That's where a pull groin muscle is one of these. One of the things that you can do is work over the sheet, go to the pubis symphysis, or have the client put their hand over the pubis, and then you work over that, over the sheet with your hand over it to work all the origins, because all the origins of the pubis are right here in the pubis symphysis. The pectineus is the most superior one. So this blue one will be the pectineus, and it originates at the superior ramus of the pubis, and it inserts at the pectineal line of the femur. So the femur is right here. So they all insert right on the femur. Right underneath the pectineus, you have your adductor brevis. And remember, if you have a brevis, you're going to have a longus. So the brevis also originates at the inferior ramus of the pubis, and then it inserts on the medial pectineal line of the femur. Then you've got your adductor longus, also originates on the pubic tubercle of the ramus, and it inserts right here on the femur, the pectineal line of the distal part of the femur. Remember, this is the proximal end of the femur. This is the distal end of the femur. And then the adductor magnus is the massive one. It's this yellow one, and it covers really almost all of this, like underneath. So this one, the magnus, originates from the inferior ramus and also from the ischium, which is your sits bone, and it covers almost all of the medial part of the thigh. It's the yellow one. It inserts all the way from here, all the way down to the medial lip of the linea aspera and the adductor tubercle. So it's a massive muscle. That's why it's called adductor magnus. And the 5th one is the gracilis. The gracilis originates from the inferior ramus of the pubis, and it goes all the way, and it inserts on the pes anserinus. Right here you have 3 attachments at the pes anserinus, which is the gracilis, which is one of the adductors, the semitendinosus, which is one of the hamstrings, and then the sartorius. Now, the sartorius is not part of the quad, so I didn't draw that today. Sartorius is the longest muscle in the body, and it originates from the anterior superior iliac spine, and it crosses and it inserts right here. There's 3 muscles that insert right here. So make sure that if somebody has knee problems, that you really work this pes anserinus. And you can place the leg like this in order to really work the adductors. I would be on the opposite side of the table and just working all of these adductors, working cross fiber. I'm not going to show you too much of the techniques right now because this is for the kinesiology class to learn the muscles. So there you have the 5 adductors. Remember, 5 adductors, 4 quads, 3 hamstrings. So let's move on to the 4 quads. So now we come to the quads, the 4 quads. The longest of the quads is the rectus femoris. The rectus femoris, because it's on the femur, is the longest one, and it crosses the only one of the quads that crosses 2 joints. It crosses the knee joint and it crosses the hip joint because it also helps with hip flexion. So This one originates at the anterior inferior iliac spine. So it originates at the AIIS. It originates here, and it goes all the way down, crosses the knee joint through the patellar tendon, and inserts at the tibial tuberosity. Tibial tuberosity is right here. All four of them insert right there. The sartorius, which I mentioned, is not part of this lesson, but it does originate at the anterior superior iliac spine. So it goes further higher up, and it crosses and it inserts right here along with the gracilis and the semitendinosus. Remember that in order for muscles to move a joint, they have to cross that joint. So all these muscles cross this joint. So guess what they do? They move the knee. These are the ones for flexion. For, you know, when you're gonna kick a ball, you flex your knee, and then you're gonna kick it out. Once you kick, that's what the quads do, the kicking motion. The hamstrings will be the closing motion, the flexing. So these are extensors of the leg. You've got your rectus femoris, which is the longest. You've got the three V's, the vastus intermedius. Inter means in between. It's in between the vastus lateralis and vastus medialis. Medialis because it's towards the medial side, lateralis because it's towards the lateral side. So the intermedius one is underneath the rectus femoris. It's this green one, we just kind of drew the edge of it because it's underneath this one. So this is the vastus intermedius, crosses, and it inserts also right at the tibial tuberosity. The vastus lateralis is the largest of the quads. It is massive. It is massive. You know, you can usually tell athletes, you know, that little bump right here. I could see her. She's got a good one. She's got good legs. But this one goes all the way here on the side, on the lateral side. And again, it inserts at the tibial tuberosity through the patellar tendon. Now, the fourth one is the vastus medialis. It's the one that looks like a teardrop. So this one right here at the end, it looks like a little teardrop. And so this one is on the medial side of the leg. So the four quads are the rectus femoris, the vastus intermedius, the vastus lateralis, and the vastus medialis. And these are for knee extension. Knee extension. Now we're going to move on to the hamstrings. We do that knee flexion when you bend your knee. So let's turn her over prone so we can show you. Okay, we move on to the hamstrings. The hamstrings, there's only three. Remember, 5 adductors, 4 quads, 3 hamstrings. So we've got to begin with your biceps femoris. Biceps meaning it has 2 heads. Femoris because it's on the femur. Biceps brachii also has 2 heads, but brachia because brachium is the arm. So that's how you can tell the difference between the biceps femoris on the femur and biceps brachii is on the arm. So don't get those two confused. Now, all the hamstrings originate at the ischium, which is your sits bone. It's the lowest part of your pelvis. So right here is your sits bone, which is your sits bone is the bone you sit on. So all 3 of them originate here. Now the long head originates at the ischium. Now the short head of the biceps femoris originates right here on the linea aspera. Okay, so this is the biceps femoris, and it inserts on the fibula, which is the lateral bone, the fibula, the head of the fibula. Remember, the fibula is the bone that doesn't bear any weight. It's the tibia that bears 90% of your weight. The fibula only 10%. So biceps femoris has 2 heads. One originates at the ischium, and the other one originates right here on the lateral part of the femur. And they go to the head of the fibula. The other 2, the vastus tendinosus, originates right here on the ischium, and it goes down. It's pretty massive, and it inserts right at the pes anserinus. Remember, the pes anserinus has the 3 insertions of the gracilis, from the adductors, the sartorius, which is not part of any of these three, and also the semitendinosus, gracilis, and sartorius. They insert right here at the pes anserinus. Then you've got your membranosus, your semimembranosus, which is the most medial. Membranosus with an M for medials, the most medial. And it goes down like this. It's probably a little bit thicker than it was drawn here, but it originates at the ischium and it goes down. It's the blue one, and it inserts right about here. So this is why it's so important for you to work, to lift the muscles, to do the ringing, to separate the muscles as you go up, separate the fibers, the muscle fibers. And remember, these are the ones that are going to be for flexing the knee. All of these cross the knee. So what they're going to do is they're going to flex. They're going to pull up for you to flex that knee, for you to flex that, all of these muscles to flex the knee. And your quads are going to extend it. Your quads are the opposite muscles on the anterior part of your leg. And what they do is they're going to extend the knee, like when you're going to kick a soccer ball. That's extension. This is flexion, the closing of an angle. This is extension, and that's for extension, that's the quads. These are the agonists when you're doing flexion. These are the main muscles when you're doing flexion because they're the agonist, and the opposite ones will be the antagonists, will be the quads. And the reverses, when you are going to kick the ball and extend your leg, these become the antagonist, and then the quads become the agonist. They perform, it's the yin and yang. It's the yin and yang, guys. It's like muscles work together in groups. One has to shorten in order for the other ones to extend, and then they reverse. The other ones have to shorten in order for the other ones to extend. So these are the hamstrings, the adductors, and the quads. The nerve that innervates the hamstrings is the sciatic nerve. The nerve that innervates the medial part, the adductors, is the obturator nerve. And the nerve that innervates the quads is the femoral nerve. So make sure that if somebody's having problems, even with low back, let me talk a little bit about, the low back. The rectus femoris also connects with a tuberous ligament. They connect with a tuberous ligament. So if the hamstrings are really tight pulling, they're going to pull on your low back. So a lot of times it's the tight hamstrings that can cause low back pain. So make sure you check out, the hamstrings. And of course, you've got to work the whole thigh. If you've got somebody coming in, with leg issues or low back issues, check out the whole leg. Because, look at how many muscles are here. You've got again, I'll repeat them, 5 adductors, 4 quads, 3 hamstrings. And this is the thigh, and this is the leg. Make sure you work everything. If you know the movements of your muscles, you'll be able to help your clients a lot better. So until the next time, create a great day.